1 million families in my home state of Illinois, state of 12.5 million people. 1 million of them have at least one uninsured family member, including 360,000 of those families that earn more than $50,000 a year. They earn $1,000 a week and they don't have health insurance. Well, if you look at the cost of health insurance, you can understand. For some families, even $50,000 a year makes it difficult to protect everybody. Being uninsured is no longer just a concern of the poor. In fact, the poor many times are taken care of with our Medicaid program. It's a risk for many of us, many in middle-income families. Members of Congress are pretty lucky. We get the same health care protection that federal employees receive. I think it's the best plan in the nation. But most people in my home state are not that fortunate. Let me tell you a story about a fellow in Springfield, my hometown. His name's Doug Mayle. Since 1988, he's owned a small business in downtown Springfield. He sells cards. He's fortunate, over 65 years of age, and also receives spousal benefits from her late husband. If this were not the case, Doug doesn't think he could possibly provide health insurance for his only employee. As for himself, Doug knows that because he has a pre-existing condition, he faces the real possibility of becoming uninsured. Almost 30 years ago, Doug was diagnosed with a congenital, no symptoms, regular health care. He's at a great risk for developing serious problems. Like most Americans, his health care premiums have risen dramatically in recent years. 2001, he paid $200 a month for health insurance in Springfield, Illinois. 2005, he paid $400, and after he turned 50 years of age last year, his rate shot up to $750 a month. He has a little business. It's hard for him to pay that. To keep his insurance affordable, he chose a smaller network of providers and a higher deductible, brought the cost down to $650 a month. Then last year, the payment jumped again to over $1,000 a month. Only by taking the highest deductible has he been able to bring that cost down to $888 a month. Think about that for a minute. That's $10,000 a year this small business operator faces for basic health insurance with a high deductible. And he isn't even a costly patient. With his high deductible, the insurance company has never paid a claim for illness or injury beyond routine primary care. His costs have exploded. But he can't afford not to have health insurance because of his faulty heart valve. He needs antibiotics before undergoing even a simple procedure like dental work. Though Doug should see a cardiologist periodically, he avoids it. He fears it would just add another red flag to his medical record. Think about that for a second. Avoiding basic medical care for fear that it will raise the price of health insurance. That is a reality for a lot of people in America. Why in this wealthiest nation on earth do we accept a system like this, where a small businessman with insurance has to delay preventive care simply to avoid short-term costs, even though the long-term costs, if something awful happens, could be far greater? All Americans want the best health care system in the world, yet we all know that reform isn't easy. The process will be complicated. We'll have to compromise and we'll have to work together. But we've got to start by laying the foundation. President Obama's budget does that.